Hello and welcome to this special episode on piles, fistulas and fissures. With me in the studio is Dr. Viraj Kandolkar, a very skilled laproscopic and general surgeon. He's empaneled with major hospitals in Porvorim and Panjim and primarily in R.G. Stone Hospital, Porvorim. Dr. Viraj has done his MBBS and MS surgery at the Goa Medical College and has worked in various hospitals in Delhi and Hyderabad. Dr. Viraj, welcome to the show.
Thank you for having me on board, Stacey.
Right. So, Doctor, going right out into the topic, what could be the various ailments that affect the anal region? What would be the broad classification of them?
In my common day-to-day practice, the most common anal complaints that I see is of piles,
Right.
followed by fissure and fistula in sort of equal proportions.
Right.
The most common is piles or hemorrhoids. They're both one and the same thing.
Okay.
Hemorrhoids being the most common.
So, what exactly is piles? I mean, is piles and hemorrhoids the same thing? And what is the background of it?
Piles and hemorrhoids are the same thing. Okay, in common like Konkani taka bhik manta. English piles and hemorrhoids are the same term for the same condition.
Right.
In Hindi it is called bawasir,
Okay.
and Marathi it is called mulvyad.
Yes.
Okay, so now this piles is nothing but enlargement of the veins and blood vessels of the inner lining of the rectal and anal canal, which
Okay.
sort of become enlarged and protrude outside through the anal canal, which can cause discomfort and bleeding and other symptoms.
Right. So, Doctor, what are the causes of piles? Or what leads to formation of piles?
Piles nowadays has become a sort of a modern day epidemic or endemic.
Okay.
And it is most commonly directly related to the poor lifestyle and poor food choices that we make these days. You know, there is poor consumption or very low consumption of dietary fiber,
Right.
less amount of water,
Yes.
consumption of processed foods like cheese and maida products,
Right.
and consumption of less consumption of leafy vegetables, sedentary lifestyle, obesity.
Right.
These are some of the risk factors. Some habits like smoking, chronic smoking, and alcohol consumption also has been shown there is a direct contributing factors for piles.
Besides that, is there any other factors that can contribute to piles?
Piles can be common in pregnancy.
Right.
You know, commonly seen in the later half of the first trimester to till the end of the third trimester.
Right.
It is quite common.
Doctor, could, if I may ask out of curiosity, spending a lot of time in the washroom also lead to piles because we are so used to taking our mobile phones?
This is one very common trend nowadays with the mobile phones.
Exactly.
And endless scrolling which happens. People get stuck in their washroom on the commode for a long hours. And along with a poor posture, that leads to hemorrhoids.
Right. So, Doctor, is there a particular age group as well which affects piles and a particular gender, or is it just like
no, piles is sort of universally common throughout, males and females. Only females during pregnancy it is higher incidences.
Higher incidence, right. So, Doctor, what are the presenting symptoms of piles that a patient would initially notice?
Now, piles, patient will complain of swelling of or feeling lumps in the anal region, or he can complain of discharge in the anal region, which leads to irritation and itching.
Right.
It can also cause bleeding, and bleeding is one symptom which needs to be taken little seriously.
Yeah.
Because there may be something occult hiding, like cancer of the rectum or the anal canal or the
which
colon.
Which could have been missed, thinking that
which
the
could
patient
be missed.
has piles.
Now, many times it happens that patient present with piles,
right.
but may also have a concomitant malignancy.
Yes, right.
So, it is very important for a surgeon to examine patients with bleeding per rectum.
True. But doctor, is there any red flag symptoms like which the patient should be absolutely, take it seriously and meet the doctor immediately?
Bleeding is one of them. Or if there is a pain, acute inflammation of the piles, which does not settle on its own for 2 to 3 days,
and it's quite painful,
then patient should seek medical advice. And if there is any high grade fever associated with swelling in the anal region, which indicates that there is some amount of local sepsis or infection taking place, which probably leads to an abscess, and surgical drainage is required.
Further complications. Moving on to, is there any basic things or home remedies that we can do initially when we have like the primary symptoms of piles?
Yes, patients, as I mentioned, piles is like very common these days due to our lifestyle choices, and it may not be that every person who is having like minor early piles requires some intervention. So patients who are having some discomfort initially can sort of self-medicate or start by changing their diet, increasing the fiber in diet, through green leafy vegetables, multigrain atta, or fruits which are rich in fiber.
Like your bananas, papaya.
Yes. And reduction in your oily, fatty foods, alcohol, stopping smoking. Apart from that, if patient is having pain, initially a simple paracetamol will take care of the pain. But patient should not be dependent on continuously taking paracetamol to alleviate pain, as important illnesses may be missed. And apart from that, some sitz bath can be taken. It's a simple technique wherein patient can sit in a tub, plastic tub, small plastic, with lukewarm water for about 5 minutes in the morning and evening.
That helps with the inflammation.
That helps with the discomfort, anal discomfort and pain. And also, if nowadays over-the-counter laxatives are available, so if patient is having constipation, they can sort of relieve the constipation. However, it's very important to note that if your symptoms continue or persist beyond 2 to 3 days, please seek medical advice or see your surgeon.
Doctor, I'd like to ask, is there any role of spicy food also in the development of piles? Because a lot of time people think that because they're eating spicy food, they get piles.
No, spicy food has no direct relation to piles. However, if you're having a lot of painkillers and spicy food together, then it's not a very good combination.
So basically, it is just to say that fiber is more important in your diet. You should include green leafy vegetables and fiber.
Yes.
Doctor, moving on, what could be the complications of piles if we ignore the primary symptoms and the red flags and leave piles untreated? What could it lead to?
So this was quite common in the rural setting, where patients just ignore their symptoms. Even in in a city patient, they ignore their symptoms, they continue self-medicating, and then they present with severe anemia. Especially our women in the rural areas, where because of anxiety or they feel ashamed to show doctors. They don't come very early on, and they come with severe anemia, which may require blood transfusions and all. Also, if it is ignored, it can lead to prolapsed piles, where the entire piles just come out and doesn't go back in. Then again, that is like at a very advanced stage where simple treatments won't work, where surgery will be absolutely necessary. Or it can lead to thrombosis and clots and infection, which again requires immediate surgical intervention. So these are the main complications.
So doctor, what are the various treatment modalities for piles or hemorrhoids?
Now, treatment for piles and hemorrhoids, I would first say that everybody doesn't need treatment. The patients who are asymptomatic, they don't need any treatment.
Like a few diet changes, lifestyle changes
early hemorrhoids usually can be managed with your lifestyle changes, diet, and changing of your toilet habits,
Right.
like avoiding prolonged sitting in the washroom,
Avoiding
avoiding
constipation.
constipation, and avoiding excessive straining while passing motions.
Right.
Okay. Other thing is simple hemorrhoidal creams are available. The tablets, medicines, medical management
Yes.
is common for early grade 1 piles. So grade 2 and 3 piles usually require some sort of intervention, okay, which in the primary will be go-to treatment would be on minimally invasive treatments like laser treatment, piles banding, injection sclerotherapy,
Yes.
which are like day care procedures which can be done very easily.
Yes.
And doesn't require a big treatment.
Yeah.
Grade 4 piles and some of the grade 3 piles also will require surgical excision, the conventional surgery.
Yes.
For piles.
Right. Doctor, as you mentioned about laser treatment in piles, we see it a lot in various ads also, in the newspapers also. So what is this laser surgery in hemorrhoids?
Now, laser surgery is sort of becoming the go-to treatment.
Yes.
Okay, as it is very laser basically is a very highly focused beam of light. Okay, which produces coagulation and sort of burning of the piles from within.
Okay.
So it can be done in a very fast setting, doesn't require a big setup. Okay, it doesn't require a prolonged stay, doesn't require a simple anesthesia should do it.
Yes.
Okay,
Then
it's a short 20 to 30 minutes procedure.
Right.
Patient doesn't have to stay in a hospital for overtime. There is a fast recovery.
Yes.
The recovery period, the healing is faster with laser being minimally invasive. It's relatively painless. When I say painless, if there are internal piles, then they won't cause much pain. But external piles, there might be some pain, but it will be much less than conventional surgery.
Right.
And it also helps in the patient going to resuming their normal day-to-day work earlier. So in that sense, laser has given us a cutting advantage over the conventional sort of treatments.
Right. So doctor, now post-surgery, whether it's laser or normal surgery, what would be the precautions or aftercare that a patient needs to take?
That's a very good question. So initially after surgery, patient will be under some sort of anesthesia, and as the effect of anesthesia wears off, some amount of minimal pain will be there. So he'll needs to take his antibiotics, the painkillers which are suggested. He needs to take a stool softener to reduce the constipation during post-surgery, avoid straining while passing motions.
Yeah.
Again, simple hot water or lukewarm water, sitz bath should help in sort of ease the discomfort. Other than this, there is no major sort of restrictions on patients after surgery.
With regards to diet?
Yes, diet, as I mentioned, as I've been harping again and again, include high fiber diet. Okay, initially because the surgery is there and painkillers are there, I always recommend my patients to avoid spicy food because it will cause more acidity along with the painkillers.
Yes.
So other than that, there is no any specific management which is sort of which precludes patients from resuming their normal work.
True. So doctor, when is surgery absolutely indicated in the treatment of piles and hemorrhoids?
Okay, as I mentioned earlier, if the conventional treatment doesn't work, if all the medicines, tablets, ointments are tried, and if patient doesn't get any relief with that, if they have grade 3 or grade 4 piles, or if it is complicated piles, as in if there is a thrombosis, which results in an abscess, or if there is prolapsed piles. Okay, so in these cases,
or strangulation.
In these cases, the surgery is absolutely recommended. So sometimes it may be that the patient is having one pile which is big and the other piles may be small. So there might be a a combination of two different modalities of treatment. So we may use laser on one or two piles, and the other maybe requires surgical excision. Okay. So it's not that if you do laser, some patients we have to tailor make the treatment.
The process, yes.
That each patient will be different.
Right.
Okay, and we have to suit the treatment and the surgery to that particular patient.
Absolutely. So, doctor, that was about piles. Moving on to the next topic of this discussion, we have fissures and fistulas. How are they different from piles, and what are they? What are fissures and what are fistulas?
So, fissures is nothing but so as the term suggests, it's a split in the anoderm, the anal lining. Okay, and it happens due to excessive stretching of the anal sphincter. Okay, during passage of very hard stools, or sometimes even during repeated passing of motions with too much of straining.
Yes.
And it causes, it can also cause bleeding. It can cause a lot of pain while passing motions.
Right.
Okay, and discomfort and itching. So an acute fissure usually resolves with medications and doesn't require any major surgical intervention. But if it does not resolve with some medication, then it's better to do small minor surgical intervention.
Right. But is there bleeding also in fissures as there is in piles?
Yes.
But the same intensity?
Yeah, it may not be of the same intensity, but the patients won't be able to differentiate. The doctors may be able to.
Yes. Okay. And doctor, what is fistulas now? Coming to the last type of anal ailments.
Fistula, in other terms, like in Marathi or Konkani, it's called bhagandar. It means like it's an abnormal sort of a pathway or a tunnel which communicates the internal anal canal to the outside skin.
Yes.
Okay. It can be a simple fistula, wherein if this simple fistula is usually low-lying, straight fistula, and there's only one track. Okay. And there may be complex fistulas also, where there may be multiple branches. Usually a fistula which is neglected, the type 1 simple fistula which is neglected, will eventually lead to a complex fistula formation, which is much more difficult to treat. The symptoms of fistula will be, there will be discharge through the opening wherever there is the fistula's opening is there. It will cause itching, and sometimes it can cause a lot of pain when there is a formation of an abscess within the fistula tract. The treatment will depend on what type of fistula it is. So we'll many times we may require additional investigation like a fistulogram to know what is the track, where exactly is the track going. Is it a high fistula? A high fistula is where the
somewhere higher up in the
it is coming from the anal canal, but it may be going high up above the levator ani muscle. Okay. In which case it's a very complex surgeries, and laser treatment may be required, and they are difficult to treat also. So my advice to any person who is suffering from fistula is, if it is a simple fistula, the earlier you intervene surgically, it's the best it is. Avoid complications of any fistulas.
So doctor, how do fistulas develop? Is it like a pre-existing condition like congenital, or it develops suddenly later on in life?
No, it is usually it is an acquired infective process. Okay. Sometimes the other conditions, very rarely, some autoimmune conditions can lead to fistulas also, like Crohn's disease. But mostly which we see in our common practice is infective type of fistulas, where small anal glands get infected. And they don't immediately form an abscess or drain into the anal canal, but sort of burrow into the surrounding sphincter, and they track along. Either they come out on the skin and open, or they may go up. Which will result in a high fistula or a complex fistula.
Doctor, can fistulas also develop as a part of any surgical complication, like maybe during childbirth or anything like that?
May not necessarily, but during childbirth there have been cases of fissure quite common, or rectal anal sphincter getting injured during difficult labor. It has been noted in the literature.
Right.
Okay, and also not very uncommon.
But not very common.
Not very common.
Right. Doctor, so now moving on, how do you treat fistulas? Is there by and large only a medical management, or is it surgical as well?
No, treatment of fistulas is always surgical.
Okay.
There is no medical management. Okay, some patients may feel relief with taking antibiotics
because it's infective,
where the infection process will dial down.
Right.
But since the fistula is not removed, it will reoccur again once the antibiotic is stopped.
Yes.
So the treatment of fistula is always mandatory. Surgical. When I say surgical, it need not be only like a straightforward surgery.
Right.
Nowadays with laser, so major surgery can be avoided.
Okay.
Okay. So laser treatment for fistula is a quite promising option also. Okay.
So doctor, what could be the benefits of choosing laser surgery as a treatment for fistula over the normal conventional surgery?
So that is very important. If if it's a low fistula, okay, then what advantage laser is that it prevents, means normally when we do a fistulotomy and remove the entire tract, and it may result in a big wound which will require regular dressings.
Right.
So all that hassle is sort of avoided.
Yes.
Okay. But the caveat is that there is a risk of recurrence. Okay, with the fistula with the laser surgery.
Right.
But the recurrence rates are quite low.
Yes.
But recurrence rates are equally there following a conventional surgery. But you avoid the hassle of doing a painful procedure, right, and hassle of doing regular dressings or something like that.
Okay.
Pain is much less, faster recovery, and it's a short procedure.
And also I think blood loss and other factors with regards to surgery.
Yes. With that respect, that advantage laser gives us.
Yes. So doctor, there's a lot of reluctance sometimes even in women to come forth with reasons of bleeding during passing motion. Even for that matter, people choose to go to these ads that we see in the newspapers where there is free treatment for piles and all fistulas and etc. There's reluctance to go to a surgeon and get treatment rather than take over the counter medication. So what would be your message to the viewers on that?
I mean, it sounds kind of rosy when somebody says that they will take care of your ailments without any major side effects and everything. And most important factor here is patients or public's general lack of knowledge. Yeah. We always shy talking about hemorrhoids, piles, whereas it's quite common. Every fourth or fifth person might be having hemorrhoid or piles. So I want to convey to people that don't get ashamed. You'll have to, rather than going to quacks or some shady practitioners of claimed this thing. So I would say consult proper doctors, meet your surgeon, okay, get yourself evaluated, and get yourself treated. Yeah. Okay, shame is one of the main factors which is sort of preventing people from coming to a doctor's.
Right. So doctor, we are now in the month of April, and as you know, 7th of April is celebrated as the World Health Day. What would be your message to the viewers with regards to World Health Day as well as on our topic for today of piles and fissures and fistulas?
As I say, we are very concerned of what we put in the mouth and taste wise everything. So we should be also equally sort of taking care of the rare end, wherein we don't, it's nothing to be ashamed of. Okay. Yes. And common hygienic practices, better diet, balanced diet, high fiber diet, consuming lots of water, ditching the bad habits of smoking and alcohol. Involving little bit more exercise in your day-to-day activities. Okay, not only it will improve your heart health, overall health, it will also help in avoiding piles. Right. Okay, and consulting your doctor without unnecessary delay.
Yes.
That is
Because
very,
like you said,
that is the point at which I would want to stress.
yes.
Okay, rather than going on and on with unnecessary treatments and procedures.
Right.
Okay.
As much as it's important to treat the piles, it's also important to get a proper diagnosis, because it could not be piles, it could be like a carcinoma, it could be cancer.
Yes.
That early detection also helps in the treatment and better
Absolutely.
expectancy in the life.
Absolutely.
Right.
You nailed that.
Yes.
You nailed that topic.
Yeah. Thank you so much, Dr. Viraj, for coming to the studio and giving our viewers information on piles and diseases of the rectum. I'm sure the viewers enjoyed watching and gaining this information from you.
It has been quite an honor for me to talking to you on this topic,
Yes.
which is sort of relatively a taboo topic.
Right.
But thank you for having me here. It's been a
Yes.
wonderful year.
Likewise, Doctor. Thank you so much for watching. Take care. Keep watching Prudent.